Good morning. Thanks for joining us today for Coffee and Conversation. I am here with Dr. Maria Doucet, and we are talking about the topic of hoarseness today. So if I'm experiencing hoarseness, when should I be concerned? When should I call my doctor?
Sure. So typically the rule of thumb is if you're having symptoms for more than 4 to 6 weeks, it's time to get an answer. So if you know you've recently had a cold or a sinus infection, or you've been at a sporting event and you've been screaming, or you have a reason for the hoarseness, many of those acute reasons will resolve within 4 to 6 weeks. But if you have symptoms that persist more than about 4 to 6 weeks, it's really time to get in to have the reason for the hoarseness looked into.
So what could cause hoarseness other than cold symptoms or speaking loudly? Is there anything else that could cause it?
So definitely, we often see hoarseness in teachers, people who are in a position to use their voice frequently. Sometimes in children, it's either just being overly excited on the playground and rumbling with their friends, but vocal use or vocal over abuse is a reason for hoarseness. It definitely can be related to allergies and postnasal drip, and it's surprising how many patients come in and don't feel like they have significant allergies, and they'll say, I don't really have a runny nose to the front, or I don't really have sneezing, but on exam you can see evidence of a postnasal drip. So allergies can present differently to different people. So for some people it is running in the front, for some people it's running in the back. But allergies can cause hoarseness. Dryness in your throat and larynx can cause hoarseness, so sleeping with your mouth open. Reflux, there's a condition called laryngopharyngeal reflux, which is a little bit different than gastric reflux. So if you have acids in your stomach and they're coming up to your esophagus, the esophagus is lined with bicarbonate, so the esophagus can neutralize some of those acids. But sometimes at the level of the upper esophageal sphincter, there's weakness. And so when you go to sleep at night, or if you cough or laugh a lot and just a little bit of the acid hits the larynx doesn't have neutralizing agents, and so that can cause swelling, which can lead to hoarseness. So that is often called silent reflux, because you may not have in particular signs and symptoms of gastric reflux, and many times the only time we can diagnose it is by looking with the scope at the larynx to see it. There are neurologic reasons for hoarseness. Neurologic disorders can affect the movement of the vocal cords. Smoking or inhaling chemicals can definitely contribute to hoarseness, laryngitis. So there's lots of things that can contribute to hoarseness that will cause the symptoms to go on. So anytime you've had symptoms for more than 4 to 6 weeks, it's time to just get a look and try to figure out what's causing that.
Okay, and what are some of the treatment options?
I
know there's like a lot of different causes, but what are some of the different options for each one?
So when you come in and tell us about your history of hoarseness, of course, we'll take a thorough history and exam. We'll try to elicit in your history whether you've had any vocal abuse, whether you're smoking or drinking, or had any change in medications that could contribute to it. But on exam, the only way to evaluate the larynx, which is the center where the hoarseness is coming from, is to do a scope. And it is called a flexible fiber optic nasopharyngoscope. And that scope is, I try to downplay it to my patients. It's really just a tiny little flashlight, okay? But we have to put it in your nose to look at the back of your larynx. And if you look at any documentaries about singers, or I know in the Justin Bieber documentary, they actually showed him getting a scope on his concert tour, but it's the only way that we can look at that area. But once we get a good look at that area, it's easy to determine whether we see significant postnasal drip, whether we see, evidence that acids are coming up and irritating the larynx. Sometimes we see simple things like a vocal cord nodule, and a vocal cord nodule is benign as a result of something that's causing chronic inflammation, often vocal overuse. Of course, there could be a head and neck cancer. That could be a reason, and many times by looking on exam, we can determine what the cause of the hoarseness is. Once we find the cause, we try medical management. Of course, if it's something that looks atypical, then a procedure is often scheduled in surgery to take a biopsy, and having a piece of the tissue often can rule out some significant issues. But many times it's something that can be managed with medications. So treating a postnasal drip, sometimes that's tricky because medications that we use to treat allergies can cause dryness, and dryness can make the hoarseness worse. So we have to look at the medications that you're choosing and make sure that you're not taking medications that can cause dryness. As time goes by, our ability to hold onto moisture decreases, so we need more moisture on a more regular basis. So if you listen to someone on the phone, you can often tell if they're younger or older by their vocal quality. And so even as time goes by, the laxity of the muscles or the lack of hydration can affect the voice. So the treatment really depends on what the findings are when you come in and have a scope. But many times it's a matter of choosing the right medications to maintain the balance of hydration but control of the postnasal drip, or maybe we need to manage your allergies. If we do try reflux medications, then we'll often start the medications and see you back in about 6 weeks to see if there's been improvement on the inside. So the most important thing is the only way to evaluate the larynx is with a flexible scope. So if you do have symptoms that persist, it usually is something that an ENT physician has to evaluate you for. And it's important to take a look, implement a treatment plan, take a look again, just to make sure that it's resolved.
Okay, what are some questions that someone may ask their primary care? I know you're a specialist, so a lot of people come in, you know, they're referred here, and so you're able to take a scope. But if someone's going to their primary care, what are typically some questions that they could ask their doctor or should ask?
So things to be concerned about are you having difficulty swallowing? Are you having trouble swallowing liquids or solids, or pills getting stuck when you take pills? Is the hoarseness something that gets worse throughout the day, or is it something that's constant with you? Is it causing a shortness of breath? Those can indicate different reasons for hoarseness. So it can be something as simple as postnasal drip to something as significant as cancer. So even most recently, we had a patient who presented with hoarseness as his only symptom. And on scoping and evaluating in the office, we did find that one of his vocal cords wasn't working. And on workup, he wound up having metastatic cancer. So most important thing is, if your symptoms are going on for more than 4 to 6 weeks, get an answer. But the questions that should be going through your mind that are associated with the hoarseness would be weight loss, trouble swallowing, shortness of breath, fever, you know, the things that just aren't quite usual. Sometimes they come on so subtly that you don't necessarily recognize them as abnormal until someone prompts you to that. So when you ask a patient, are you choking on liquids, or are you having trouble swallowing food, then they'll say, well, yeah, I have been doing that, but they don't necessarily report it as abnormal because it comes on very subtly.
Okay. Well, thanks so much for sitting with me today and addressing this topic. I know a lot of people experience hoarseness, but they don't really know if it's a real concern or something that they should have checked out.
Right. So definitely worth having a conversation about.